According to the Lewis and Clark County Community Report, from 2015 to 2020, nearly 23% of the adult population in Montana have been diagnosed with depressive disorder, compared to the national average of 19%. There are many different reasons for the state and national percentage differences.
There's a lot of stigma around mental health, and that's another component as to why we have such a big problem in Montana, is because we're a little bit of a pull yourself up by the bootstraps kind of state.
Montanans also suffer from vitamin D deficiency, high elevation, and alcohol use, which are all pieces of the mental health puzzle of the state. For Lewis and Clark County, the suicide mortality rate is 24 deaths per 100,000 compared to the U.S., which is 14 deaths, and public health is working on getting the rate to 12.8. Whether it be training gun dealers at stores to recognize when someone is struggling or medication storage.
And lethal means postvention support, and then getting people to the appropriate level of care. And that's not just us, that's also the mobile crisis response team, that's crisis intervention team trained officers. So it's really about how can we all come together to support our community.
For the future, public health plans to create a crisis receiving and stabilization facility in 2022.
Once that we're able to take that to launch with community engagement from the mental health centers, collaboration from, possibly peer support, and the major players like the hospitals here, that we can look into our next step. And so we will be fully focused on that in 2022.
But in the meantime, there are steps to be taken to ensure that you do not feel isolated.
Being around people as much as possible, if not in person, communicating with individuals, your family, your friends, your neighbors, reaching out on the phone.
If you are in crisis and want help, you can contact the Montana Suicide Prevention Lifeline 24/7 at 1-800-273-TALK or text MT to 741-741. In Helena, Jordan Johnson, MTN News.